Hi, I'm Amy Lamoureux Hesbach. I'm a physical therapist and canine rehabilitation professional. I'm talk to you a little bit today about safe mobility and leash walking after your pet's orthopedic surgery. So this is a little bit of a tutorial, giving you my um, I guess, version of this. Certainly, it should complement the instructions that you get from your veterinary medical professional team, as well as your professional physical therapy and rehab professional that you might be consulting for rehab at home. So, post surgically, if there's orthopedic surgery that has been done to your pet, our focus is on supporting healing, supporting recovery through strengthening and increased tolerance of tissues to the stresses that are applied to it. We do know that tissues strengthen in the manner in which they're stressed. We also know that if we don't use it, then we lose it. So gone are the days in which you have back pain and your doctor tells you to lie in bed and rest for 4 weeks. In the same way for our animal companions, for our pets, we want them to move to heal and to get stronger, but that movement has to be performed in a safe way. And this is why you should reach out to a physical therapy and rehab professional to help guide you through this process. As we're rehabbing in that post-surgical time, we're considering the healing of not just the bone, but also of muscle, of ligament, of tendon, of joint capsule, and of the skin. So all of these tissues are under consideration when advancing the rehab program. So let's consider, and I want you to consider, because you probably don't normally, what your pet looks like in various functional positions. So when they're lying down, do they lie always to the right side, to the left side? Do they prop themselves up? Do they flex their limbs completely? Do they have a tendency to not lie completely symmetrically or not lie on one side or another? What do they avoid? What do they prefer? These positions, these activities are functional, but also give us a lot of information with regards to rehabilitation and physical therapy as to their capabilities and their strengths and the weaknesses that we might have to work on as they recover. Is your pet able to get to a sitting position? And when they're in a sitting position, what do they look like? Some pets actually avoid sitting because it may be uncomfortable for them, or they may lack the strength or mobility in certain areas of their body to assume a sitting posture or position. Do they sit to the side? Always with one leg underneath or one leg out to the side? Are they able to sit symmetrically with their back nice and flat? They have difficulty getting in a sitting position or maintaining a sitting position or moving from sitting to a down position or moving from sitting to a standing position. So again, these positions, these transitions are really meaningful to us in the world of physical therapy and rehabilitation. And they're activities that you as a pet owner can observe in your pet and note so that when reporting to your veterinarian, your veterinary surgeon, your physical therapist and rehab professional, we can work towards these goals and improving the abilities of your pet, the functional mobility of your pet, and the comfort of your pet. What about standing? Can they maintain standing on their own, or do they need help with a harness or a sling? When standing, do they distribute their body weight appropriately from right to left side, or do they unweight a leg? Do they hold the leg up, or do they come up onto tiptoes? Do they shift their weight forward onto their front legs or backwards onto their back legs? What is their head position or tail position in standing? This tells us a lot about their comfort, about their strength, and about their abilities in that rehab or that healing process. This pet, for instance, is shifted forward quite a bit. Even though pets normally put about 60% of their body weight through their front legs, this pet has closer to 70% in the front legs, maybe a little bit less in that back left leg. And what about walking? Probably most meaningful to you as a pet owner. How do you walk your pet? Do you use a leash and a harness? Do you use a collar? Are they always on leash? Are they off leash and safe in that way? Do they use all four legs? If they have four legs when walking, do they scuff their nails? Do they trip and fall? Do they have difficulty walking a specific distance or on specific surfaces? If you inspect their skin, their nails, their paws after a walk, are there nails that are broken? Is their skin abraded? Is there any bleeding or wounds? Certainly if we're seeing issues such as these, we should reach out to our veterinary medical team, as well as our physical therapy and rehab provider. To walk our pet in a supportive and safe way after orthopedic surgery, this might require certain devices. And after surgery, after a successful surgery, we actually do want the pet to weight bear. We say as tolerated, so as is comfortable for them. We want them to be able to get their paw on the floor or on the ground again. So we might use a harness, we might use a leash, a belly sling, maybe a front and back harness such as this one. We want them to be comfortable in the device, but also comfortable with walking. So the leash walking might be less of them walking us or us walking them, but us supporting them, not carrying them, but supporting them on an appropriate surface. We want you to be cautious with your body mechanics because as a physical therapist, I want to see your pet, not so much yourself as a patient, though hopefully I can help the both of you. Slings don't have to be so elaborate, they can be very simple devices. This one is a canvas shopping bag in which the seams are cut, and it's used as a belly sling to support the pet near the center of gravity. So the center of gravity in most pets is about at their lumbosacral joint, which is their low back around their pelvis. Giving them support in that at that point can certainly help them and help to unweight their limbs so that they can use them most appropriately. Stairs and ramps are really not advised to use post-operatively, at least for that early stage, but sometimes unavoidable. My suggestion is not to introduce a ramp to a pet that's never used one before. Likely they are not going to be willing to use a ramp. If you are using a ramp, make sure that you are walking along one side of the ramp or have something supporting them on one side of the ramp. Lots of pets like to actually lean up against a wall or against something as they're maneuvering themselves up and down. So going up the ramp requires more propulsion from their back end. Coming down the ramp, there's more stress on the front legs. Absolutely, we should be using a harness. We should be using some type of a sling so that we can hold on to them safely and help guide them on the ramp. In the same way with stairs, we have to consider how high the step is and how long the step is, how steep those steps are. When comparing to the body size of our pet. So a pet that has really short legs is going to have much more difficulty with stairs and more challenge with stairs in that they may need to hop or jump versus a dog that has longer legs or is larger. Climbing stairs may not be so difficult for them. Post-operatively, we want to reduce the frequency that they're using stairs or ramps, if at all, and certainly giving them support along the way. If you need more specific advice about climbing stairs or ramps, or using them with your pet, certainly reach out to your veterinary medical team as well as your physical therapy and rehab professional. And finally, getting in and out of the car. Certainly a functional activity. We want this to be safe. We want them to enjoy the ride in the car. My suggestion, at least with a pet who is older or has an injury or has had surgery, is to not travel alone with them in the car. You never know when something is going to happen. A leg gets caught, or they panic or get themselves stuck in an area where they're uncomfortable. And this can be a significant distraction to you, the driver. So when you are driving with your pet, consider using slower or wider turns, more gradual starts and stops. Use some type of restraint. So if you don't use a carrier for your pet, certainly use a seatbelt with a harness. Fold down the seating area if possible. Put other things in areas like the wheel well where, or the foot well where they might get caught or stuck. And if you're able safely to lift them in and out of the car, this is really the best option. Consider a ramp only if you've had success previously. Consider the landing area when they're getting in and out of the car, making sure that it's open, that it's not non-skid, that there's a straight trajectory, and that it's a safe area. Practice these car transfers, getting in and out of the car with your pet, with your veterinary medical professional or with a rehab professional, so that we're sure that you're performing it safely for you as well as for your pet. So that was just a brief overview of functional mobility and leash walking with your pet, especially the considerations that you might need to have for a pet that's had orthopedic surgery or that might be a bit older. If you need more information, or if I can help connect you with another rehab professional in your area, feel free to contact me. Email is fine, social media as well. You can find me on Instagram, sometimes on Facebook, always on Teachable. And you can see my Teachable Kickstart program, which really covers rehab in the first 2 weeks after cruciate ligament surgery. If you're interested in this, feel free to click on the QR code, and I'll see you online. Take care. Bye-bye.